So something we've been working very closely on lately is actually related to 3D printing of skull plates. Typically, when a patient comes through the door and has a large skull tumor, the way that we would approach this patient is by looking at the CT scan and planning measurements. What's really exciting about this new technology is instead of having to make all those plans from just that image on the screen, we can actually take a model, 3D printed model, and we can recreate that, and I can hold it in my hands. From there, I can actually practice the surgery. So the first time I'm doing a surgery is not on that patient, it's actually on this model. And so in this case, you can see this was the dog's tumor. It's very large and it's in a really difficult location. And so what I did is I could actually figure out before I even went into surgery what the defect was going to look like. So we always go in with a plan, but this allows me to have even more of a solid plan and something that allows it to be much quicker. So instead of having to do this reconstruction on the fly, I can actually go ahead and have that plate ready and made. And so once we finish the surgery, we can turn around, put that plate on, and get the patient awake and back to normal as quickly as possible.